Hi, I'm Dr. Ryan Bell. I'm a pediatrician with Yada Yada Health. I want to discuss flu shots today. So, common question or concern we get from parents, especially around September and October, is whether or not they want to do a flu vaccine with their children. Flu vaccines are indicated for any of our patients age 6 months and up, with very few exceptions. Severe allergic reactions to a flu shot or any of its components. A severe egg allergy can sometimes be an issue or a concern. There are very rare conditions that would eliminate your opportunity to get a flu shot. Some of those would be Guillain-Barré syndrome or other adverse reactions to a previous flu vaccine. We'll talk about side effects as we go along. We are commonly asked about the live nasal vaccine. That is an option for patients 2 years and up who don't have a history of asthma. We also are a little bit concerned about patients who have compromised immune systems as to whether or not we want to do a live flu vaccine with the intranasal route, or whether they're better off doing a shot. The first year you get a flu shot, you should do 2 doses. They should be spread at least a month apart. After that, each year, 1 dose at the beginning of flu season should cover you through the duration of the flu season. The CDC recommends starting flu shots into September and October for kids who have never had a flu shot. Again, remember, you're supposed to get 2 shots. Flu can be very mild. It can be very severe. There are hundreds, if not thousands, of deaths every year in the United States in people from influenza. So we highly encourage people to get their flu shot, especially if you are in a high-risk group or you're around somebody that's in a high-risk group. So those would include children 2 and under, elderly people 65 and older, or again, people with chronic medical conditions that affect their immune systems. I took care of a kid in my residency in North Carolina who was a big, strong, healthy 13-year-old, got the influenza virus. His body had an adverse reaction to it. He ended up in our ICU and eventually passed away from flu and complications. So for me, when it comes to flu shots, there are some risks of having adverse side effects. Those seem to be in the range of about 1 in every 1 million doses versus the very real risk and much more common side effects of an actual flu infection, including the risk of death. So for me, I'm always encouraging patients to look into flu vaccines, encourage them to do it when it's safe, which is most of the time. And it's one that often people are very pro-vaccine for everything, and then it comes to flu and they just think, oh, I'm not quite sure. In my opinion, the flu shot is really as important, if not more important, than any of the other vaccines that we do. The risk to your child of actually getting a flu infection and having that cause a serious problem is, in my opinion, a lot higher than with many of the other things that we're vaccinated against. So we'd really encourage you to consider doing a flu shot this season. For further questions, talk to your healthcare provider. Look at credible sources like the CDC website. There's great information on influenza vaccines. Stay safe, stay healthy, get a flu shot.